Assalamu alaikum, everyone. And this is Dr. Eman Tawheed. I'm back again with another episode of Virtual Rounds, where we feature inspiring Yale graduates who are making a global impact. Today, I'm honored that someone who has seamlessly combined medicine, technology, leadership, and philanthropy, Dr. Saima Anis. Dr. Saima is a physician, public health professional, AI strategist, managing partner at augmind.ai, and founder and president of the Dow 98 Fund, which is the heart of the conversation today, Neuroplex project. I'll let Saima describe that more as we go along. Her work spans healthcare innovation, AI, enterprise digital transformation, and giving back to the underserved communities. Welcome to the virtual rounds, Dr. Saima.
Thank you. Assalamu alaikum. Thank you so much for having me on today, Eman. It's real pleasure to be here. Thank you for choosing a topic that not a lot of people want to talk about as, something that I have done differently. And I hope the message carries forth and resonates.
I definitely am so excited. I wanted to feature her. I've been running after her for a want every Dow graduate to know about the work she has done. Let's get started. I'm going to start from the beginning, Saima. I'll ask about your Dow journey, कि आपका experience भी है, like the physician you are today and the leader you are today. Dow का time को आप उससे कैसे connect करेंगी? How it helped you shape what you are today?
That's a great question. So Dow actually was far more than a medical degree. It was a turning point very early in our lives, right? We were young in our 20s, and Dow gave me resilience. It gave me purpose and lifelong friendships, हमारी ट्रेनिंग जो होती थी वो बहुत रिसोर्स कंस्ट्रेन्ड एनवायरनमेंट्स में होती थी दैट जहाँ से हमें ये सबक मिला कि वी हैव टू रिलाई on our clinical judgment, right? And we have to think critically, and we should never lose sight of the human behind, every diagnosis that we were learning to make at that point. So those experiences shaped my belief that healthcare isn't only about technology or resources. It's really about compassion, about coming together and the teamwork and, solving the problems creatively. And that stayed throughout my career.
Wonderful. So every Dow graduate carries memories that stay forever. Is there a mentor or professor or some defining moment that you remember from Dow that continues to inspire the work you do today?
We were so lucky to have many remarkable professors. One of them, I would say, in my first and second year was perhaps a relative of yours, Dr. Shoaib Tawheed. So, I would pay tribute to the late Dr. Shoaib Tawheed, who was a great mentor. And he inspired me the love of learning lifelong and also to give back at that time. And it was a vague idea that we weren't able to, or I wasn't able to completely understand. But as I went along and I reflected back on, the conversations that he would have with us, it's created a lasting impression to this day. But more than one single individual, it was the culture at Dow and then during our training years at Civil Hospital. If you recall, we had what was called Patients Welfare Association.
Yes.
I was director in planning from the second year onwards, and we learned to empathize with the tragic losses that were incurred on the surface of our major metropolis, and also how to give back by the projects that they had going in terms of the drug bank, the blood bank, and the diagnostics. And then further on to how to get funding for those projects by going school to school and getting kids to give up their lunch money, a little bit of sacrifice here, a little bit of motivation there. And there you have it. We were funded for a year again. So that's where the roots of, a lot of philanthropy also began. Those have stuck with me.
Wonderful. No, PWA is always, of course, we can never forget. But what you said is you were involved there in a leadership role too. So I think that always stays. बचपन में नजर आ जाता है the real leader होता है. That's why it's continuing right now. I can see with the work you do. An incredible, unique path you have. I really want, by the way, Saima is just 1998 graduate, but of course there are younger graduates who are coming. They would want to learn because you have a unique path from clinical medicine to clinical informatics, healthcare and analytics, and now artificial intelligence. So what inspired that transition, and what would you recommend the newcomers coming about the work you're doing right now?
So I realized very early in my career that looking at the patient demographic and the workforce that was at play during those days, vis-a-vis us and our seniors and our juniors, as residents, as interns, that I could help one patient clinically at a time, or I had a choice to make internally, which is I could help billions of patients by improving the systems that deliver care. And I was looking at it from the lens of a system that seemed fragmented, pretty broken at the time. You can imagine house job के दौरान मेरे साथ मेरी फ्रेंड होती थी ऑन कॉल आईसीयू में मेडिकल वार्ड के, और वहाँ पे सिवाय एक खाली कैबिनेट के पेशेंट्स को कुछ और, हमें कुछ और मैसर नहीं था टू डिलीवर केयर। और जितने भी टेस्ट्स उनके होते थे या उनकी दवाइयाँ होती थी, वो हमारे हाउस जॉब की तनख्वाह से हम अपनी पॉकेट से उनकी मदद करते थे। सो given that I realized I didn't want to go into clinical medicine. I applied to get a public health scholarship that I qualified for in the US at Temple University, 2001. Flew in within 10 days notice. Was a whole eye opening experience for me, the 2 years. It was a bit of a fun ride because compared to med school, this seemed easy. Not a lot of rote memorization, but a lot of really understanding and empathizing. Further on, I went to work for the Health Commissioner of Philadelphia and started the first mortality review program. And from there onwards, I think I may have become recognized for the niche. And several years later, I was lapped up by a local health system at Jefferson Hospital in their IT department to bring in that value in terms of value-based care, IT, informatics, healthcare analytics, and then eventually AI. So my journey hasn't been linear. I did take breaks, and I would recommend everybody do so to keep sane. And it's a really rough ride for our clinicians, and really admirable to go through with stamina that you all do in your clinical learning. I was lucky and fortunate to take breaks and also to be given an environment of continuous learning. My goal has always been to combine that, the medicine, data, the innovation part of it, to make healthcare safer and more efficient, and lastly, and most importantly, equitable. And so that's how I have come to be today what I am. And, in a nutshell, of course, many more details that I can't go into right this second.
Saima, just time pe bata rahi 2001. I don't
Mhm.
think a lot of people thought out of the box and applied for a master's in US at that time, who were in the medical field. I think they only thought about residency. So I really admire that you chose something, and now so many people are following that path. I see so many people now. Thank you so much for being
Thank you.
one of the trailblazers.
I appreciate that recognition. There were a few seniors from our college. I would say that I acted on I charted a path for myself. But there were seniors that had talked to me about it. And so it resonated, it stuck with me through the years, so, as an option to pursue.
Wonderful.
Mhm.
So you talked about AI, and your current work is in AI. Just wanted to, because so many people are curious about AI now, especially the physicians. How can physicians embrace AI while ensuring patient care remains ethical and human-centered?
So, first off, AI should never replace clinical human judgment. It should be looked at something that augments it, or that something that strengthens it. If you ask me, I'm not a clinician in the US, but I would advise clinicians that they need to adopt AI in their workflows with their current EMRs, so that they can get to the documentation and the patient outcomes that they wish to achieve in a way that it's automated for them, and that their clinical decision making is somehow informed by AI as well. So when you develop AI responsibly, and you are able to integrate it into the EHRs and EMRs that we now use, with transparency, with fairness, keeping privacy intact, and having that physician oversight, which is the human in the loop part of AI that we so incredibly and always need. It can definitively reduce the administrative burden, and it can improve your decision making and really allow clinicians to spend more time with the patient than they're needed. And it wouldn't be like they're staring at the computers and typing while they're talking. It's like that one-on-one gets and the level of trust. So yeah, the apprehension is only valid in as far as how people deploy it in their daily workflows.
Sure. Thank you so much. Okay, so let's get to the heart of the conversation, which is the Neuroplex project, Dow 98 Fund. And it's very close to your heart, and I think it's very close to all Dowites, and it's your initiative. So what inspired you specifically in your class to establish this fund, this project, and just give us a background so everyone knows, because some people they're too curious and some just don't know. So it will be very beneficial for everyone.
Yeah, thank you. And that's really, I think you and I talked about, this is not going to be about me. This is really going to be about the journey and how we got to Neuroplex and what that's about. So Neuroplex is a plasmapheresis unit, basically. And it's situated in the neurology ward in Civil Hospital, Karachi, which is also affiliated with Dow Medical College. It is overseen financially and sponsored by Dow 98 Fund, which is a nonprofit that we have created in the US, which I'm the president of, and I have a board. And then on the other hand, because we have not established a Pakistani nonprofit there, sister nonprofit, the Dow University's finance department, under the auspices of the vice chancellor of Dow University, has assigned us a sub-account, which then works to serve our purpose in Pakistan and from the Middle East in terms of collecting and giving out and doing administrative financial work. So that's what it is about. Now, what it does is it really helps to treat plasma, freeze out all the non-useful components of the immune system, just like a dialysis does for kidney patients. And so anybody coming in with ascending paralysis post-GBS, Guillain-Barré, or myasthenia gravis, for instance, right? So you do up to 5 sessions per patient, and you can actually completely cure the patient of that paralysis. And so the kinds of demographics that we see as patients there are really, really poor villagers, really people who deserve all the zakat and all the sadaqah and everything, 99.99%, any charitable donation. So that's how we've been able to, we built the unit up from scratch, and we soft inaugurated in 2023 August, and then a final one in December at our 25th. So really what happened was, during COVID times, we were ideating with our class on how to give back something meaningful that would outlive all of us at Dow 98 and beyond. And that's how we landed at it. It was really by consensus. It wasn't my brainchild per se. It was really by consensus. We had 4 or 5 projects that they had presented, and that's how we came to this.
Oh, wonderful. Oh, this is amazing. So what I want to understand, it's a nonprofit, as you said, registered in US.
Mm-hmm.
So for any philanthropic healthcare project, funding, partnerships, persistence, do you have any partners, or do you have other funding sources other than the Dow 98 graduates? And what have been the biggest challenges in bringing this project closer to reality and sustaining it in the long term?
Yeah, that's a really good question. I'm so glad you asked that, Eamon. So the biggest challenge has been aligning those many moving parts, right? The fundraising, the strategic partnerships, and the planning, and then maintaining momentum and creating sustainability. And we have this global alumni from Dow 98 that's all over the world. Like we have people in the Middle East, Canada, US, Pakistan and beyond, so that's been one of the moving parts. And then the other is continuous fundraising. Initially, we had confined fundraising to just the alumni of Dow 98. Since we've been at it for hundreds of thousands of dollars since year one and ongoing, we feel the need to open it up. We have opened it up to beyond Dow, and we have a lot of very generous donors. We would love to get more involvement from outside of our class. And so this is sort of an appeal to all of you who are listening to me today. It's truly a testament of what a committed alumni community can put together, but it's not without collaboration from external stakeholders. And every challenge that we faced in terms of, figuring out someone or something has happened that has, negated our, negativity about, well, how do we do this anymore, right? Some things happened at the very last minute. So we are always hoping for miracles to happen to keep it sustainable. At the current time, our hope is that, or my vision at least, is that we can turn it over validly to the local or the federal government and make it comprehensive, as in, we've completed the cycle of having someone initiate something that really ought to be the responsibility of the government, but that we facilitated it in so many ways for them to get a hold of it and run with it. So,
Wonderful.
Mhm.
More than interviewing you, I think I would love to offer you that, because I meet a lot of Dawites. We do DAO meetups. I would love
Mhm.
you can come over, or any ambassador or any representative from your class, and then we can generate some more funds at that meetup, like doing a mini fundraiser kind of, because I think the more we spread word and more awareness, the more we can help this project and you, I think.
Absolutely, and that is a great idea. And usually I don't put my face to the project. It's really the project that speaks for itself. And the outcomes that we've achieved so far, that speak for itself. We have a website that is circulated now, and I will now circulate it widely with all of you. But really, if we can do something to this effect in terms of doing in person, then that would be a great privilege for Dow 98 Fund to be represented that way and to continue to fundraise and serve this great cause. Thank you very much.
No problem. Okay, so last question on this Neuroplex project, and then we can wrap it up. What impact do you hope Neuroplex will have on future generations of patients? You did touch it a little bit, but just to wrap things up, future generations of patients, healthcare professionals, and medical education in general.
Well, at the outset, we hope that we would be able to take an unconventional approach with this and actually involve, medicine's changing rapidly. And those people who thrive to combine, have an interdisciplinary approach, they thrive in medicine. You know that. You do something similar to that, right? So we were hoping that we'd be able to get people involved at all levels of the academic training into the project for them to view and to intern and to learn from. If we could have some of those academic components in place, that would be great, especially younger graduates or students, who are still in their preclinical and clinical years.
Wonderful. So last question would be one message that you would give to the younger graduates.
Yeah, sure. So never doubt, Margaret Mead said this, I didn't, but I like to present this each time, that a small group of committed individuals can change the world. It is indeed the only thing that ever has. So don't doubt yourself. Go ahead and do your thing.
Wonderful. Last, I have these rapid fire quick questions. One word to describe Dow.
Academic chaos.
Leadership or innovation?
Innovation.
Coffee or tea?
Chai all the way.
Book that influenced your thinking?
Book. What's that? The Tipping Point, if anyone read that. Malcolm Gladwell, and all the books after that.
Okay. And last is one quality every future physician or a leader should develop.
Is adaptability, change with the times.
Wonderful. Thank you so much, Saima. It felt like I'm talking to someone from my family. Seriously, it felt so because you spoke so well from your heart, and I love the project you're working on. I wish you all the best and your class, and I will try to help as much as I can to spread the word. Thank you so much.
Thank you for having me. It was a real pleasure to be on your podcast today. And assalamu alaikum.
Thank you guys for joining us. Next time. Bye.